Hello everyone, welcome to the RX MasterClass, your ultimate guide to crushing the NAPLEX. Whether you're just starting your prep or fine-tuning those final details, this channel is here to simplify your journey and keep you motivated while studying for your NAPLEX exam. Today we're getting into the first video in the NAPLEX MasterClass. We're diving into the NAPLEX logistics, so grab your notebook and let's get one step closer to your pharmacy license. Let's get into it. On episodes 1 agenda, we have signing up with the NABP, we have NAPLEX logistics, the NAPLEX competencies, and NAPLEX advice and tips. First up, signing up. If you've already signed up with the NABP, then you can go ahead and skip this step. If not, step 1, you'll want to go on their website, which is nabp.pharmacy, then create an e-profile. Step 2 is you'll then verify that email, and then you'll be able to log into the NABP account. And then finally, step 3, you'll register your account and sign up for the NAPLEX exam. If you're having trouble finding the website, here's how you can find it. Now let's get into the NAPLEX logistics. Exam details. The exam will be 6 hours long. You'll have 225 questions, and out of these 225, only 200 of them will be scored. These are called experimental questions, and these experimental questions will be scattered throughout the exam, so you'll not know which ones are scored versus which ones are experimental. These questions include various formats such as standard multiple choice, select all that apply, and case-based questions. And you'll have an average of around 2 minutes per question. And although you'll have the 2 minutes per questions, you'll want to keep in mind that these questions could take anywhere from seconds to 2 minutes to answer, even more. Some could take 3 or 4 minutes. So throughout the exam, you just want to keep in mind that some will take longer and some will be shorter. On those shorter ones, you want to just fly through them if you already know the answer. That way you'll have more time for the other questions. As we said before, there are several question types. These include multiple choice, multiple response questions, which are like select all that apply, case-based questions, which are scenario-based, free entry response questions, and ordered response questions as well. When answering case-based questions, there are a couple things you want to keep in mind. So first, you want to see the gender. If the patient is female, then you want to check if the patient is pregnant. You want to take a look at the patient's symptoms. The symptoms can give you a clue of what the patient's chief complaint is or chief problem is. The patient's medication list. When evaluating the patient's medications list, you want to take account for any of the drugs' contraindications, black box warning, MOAs, side effects, any REMS, and their max doses. For allergies, you want to evaluate the patient's allergies, see what they're allergic to and which medications they could be allergic to. And this may actually help you eliminate a couple of the potential answers. If the patient is allergic to an NSAID and in that answer choice, one of them is ibuprofen, then you can easily eliminate ibuprofen. Moving on to labs and tests. These are usually scattered throughout the patient's case or in a specific area in the case. So you do want to examine everything you're given throughout the NAPLEX. And in your exam, it'll make you scroll throughout everything. So you'll have the full picture before it allows you to click next. So you definitely want to scroll through all the information they give you and evaluate which labs are abnormal, and through this could actually potentially give you the answer as well. So all these pieces could point you to the right answer in case-based questions. So you want to evaluate all of them on the NAPLEX exam. Along with evaluating those pieces of information, you also want to approach case-based questions in a specific way. First, you want to identify what the question is actually asking. A lot of times it could give you a ton of information, but the question is just asking a specific part of the scenario. Then you want to recall what you know about the topic. Once you know what the question is, think about the signs and symptoms, side effects, contraindications, black box warnings, REMS, and any relevant labs or tests. Then after you recall the information on that topic, you want to consider any standout details in the patient's case. Look at any unique symptoms, any duplications of medications or conflicting therapies, labs, allergies, the patient's gender and age. And hopefully after evaluating all that, you can eliminate a couple of the answer choices. Test day can either make or break you, so there are a couple things you want to take into consideration beforehand. The night before, you want to get a good night's rest. You want to sleep at least 6 to 8 hours. This will allow you to feel focused and alert on test day. You want to plan to arrive 30 minutes early. This gives you time to check in and get settled without rushing. So they recommend for you to bring 2 forms of ID. I would recommend checking with your testing center first. One of them is usually a government issued photo ID, like a driver's license or a passport. And the other one is just any other ID. You want to have your NAPLEX authorization to test letter accessible on your phone or printed. You want to wear comfortable shoes and clothes. A lot of times these testing centers are very cold, so I would wear a jacket as well. You don't want to bring in any notes or anything like that into the testing center. You'll have 2 breaks, and if you do get caught looking at your notes during these breaks, you could get in trouble, so I wouldn't chance it. You want to stay calm and focused throughout the exam. The NAPLEX is 6 hours long, but you will have 2 breaks, so if you are feeling burnt out throughout the exam, you want to utilize those breaks and make sure to relax and take a lot of deep breaths during those breaks, and use the restroom if you need to. And lastly, you want to trust your preparation. You've studied hard if you've made it to exam day, so you want to trust your knowledge, follow your instincts, and remember all the test taking strategies you've studied. With these tips, you'll be ready and feeling confident and focused on exam day. So you just want to make sure you can control everything on exam day to make sure everything goes smoothly. So for the exam, you'll have 2 scheduled 10-minute breaks, and they will not count against your exam time. However, if you do return late, then they'll reduce that time from your exam time. So just make sure if you are taking those breaks to only take the 10 minutes. And for the supplies, you'll have 4 to 5 long sheets of laminated graph paper, a pen, and a basic calculator if it is requested. You'll have a basic calculator as well on your laptop, so either one will work. And they'll also provide you with earplugs for any noise control. Now let's get into the NAPLEX most recent pass rates for the last 3 years. As you can see, there's been a consistent decline in the first-time passing rates. In 2023, the national pass rate for the first-time test takers were 77.5%. In 2022, the pass rate was slightly lower at 77.1%. And in 2021, the first-time pass rate was 81.3%. And you can see that this drop over recent years highlights the growing challenge in successfully passing the exam on the first try, emphasizing the need for strong preparation and understanding of the exam's competency areas, which we will now get into as well. Now let's get into the NAPLEX competencies. These are the current NAPLEX competencies, but they will be updated on May 1st 2025, which we'll see on the next slide. But for now, Area 1 is to obtain, interpret, or assess any data, medical or patient information, and that composes 18% of the NAPLEX. Area 2 is to identify any drug characteristics. That's 14%. Area 3, to develop or manage treatment plans. That's 35%. Area 4, perform calculations. That'll be 14%. And Area 5 is covering compounding, dispensing, or administrating any drugs, or managing delivery systems, and that accounts for 11%. Now, here is the updated NAPLEX competencies, and these will be updated on May 1st, 2025. And these are different distributions, as you could see. So Area 1 will be person-centered assessment and treatment planning, and that'll account for 40% of the exam. Area 2 are the foundational knowledge for pharmacy practice, and that's 25%. Area 3 is medication use process, and that's 25%. And Area 4 is covering pharmacy management and leadership, which will account for 5%. And finally, Area 5 is professional practice, and that'll also be 5%. Here are the competencies again, just in table form. So you can see here the distribution. The foundational knowledge of pharmacy practice, around 50 questions, 25%. Medication use process, that's 25%, around 50 questions as well. Person-centered assessment and treatment planning, it's going to be around 40%, which is around 80 questions. And for professional practice and pharmacy management and leadership, those are going to be around 10 questions each. Now let's dive a little deeper into each competency. These are going to be covering the updated competencies, which again will be updated May 1st, 2025. So Domain 1, which will cover foundational knowledge for pharmacy practice. It'll include pharmaceutical science principles and concepts, which will cover pharmacology, pharmacokinetics, pharmacodynamics, and pharmacogenomics, along with pharmaceutics. Area B, it's going to be pharmaceutical compounding. This will cover non-sterile preparations and sterile preparations. Area C will cover pharmaceutical calculations. This will be the calculations portion, which will include patient parameters or lab measurements, quantities of drugs to be dispensed or administered, rates of administration, dose conversions, drug concentrations, ratio strengths, osmolarity, and osmolality, quantities of drugs or ingredients to be compounded, nutritional needs, and the content of nutrient sources, biostatistical, epidemiological, or pharmacoeconomic measures, and lastly, pharmacokinetic parameters. Area D will cover drug development processes. Area E, research design principles and biostatistics. Area F, retrieval, assessment, and interpretation of primary, secondary, and tertiary resources. And that's everything in Domain 1. Domain 2 will cover medication use processes, which will include prescribing, transcribing, and documenting, dispensing, administering, and monitoring. Area A will cover prescriptions and medication order interpretations. This will include drug names and therapeutic classes, indications, usage and dosing regimens, available dosage forms, prescription regulations, and safety and effectiveness. Area B, therapeutic substitutions. Area C, immunization services and documentation, which will include indications and scheduling, contraindications and precautions, storage and handling, administration and adverse reactions. And Area D, which will cover medication handling, storage stability, and disposal of medications. Domain 3 covers person-centered assessment and treatment planning. This will include medication history, allergy history and reconciliation. Area B, health histories, screenings, and assessments. Area C, patient health conditions, including special populations and medication-related factors, which will include signs and symptoms and findings of medical conditions, appropriateness of therapy, interactions, errors and omissions, adverse drug reactions, toxicologic exposures and overdoses, and adherence. Area D, which will cover therapeutic monitoring, plan development, and evaluation and modifications, which will include therapeutic goals, clinical endpoints, and follow-up, safety, and effectiveness. Area E will cover patient education, which includes lifestyle modifications and health maintenance, medication use, storage and disposal, and disease state management. Area F will cover over-the-counter medications and dietary supplements. And finally, Area G will cover devices to administer medications and self-monitoring tests. Domain 4 covers professional practice, which includes adverse drug events reporting and medication error reporting, public health initiatives and risk prevention programs. C, social determinants and drivers of health. And finally, Area D, which will cover ethical considerations. And finally, moving on to our last domain, which is Domain 5, which will cover pharmacy management and leadership. And this will include pharmacy operations, inventory and supply management, quality improvement activities, and mentorship and preceptorship as well. And that concludes all of the NAPLEX competencies. So it's good to know these and just have a good idea of how the exam will look and the division of questions. Moving on to NAPLEX advice and tips. When studying, it's important to keep in mind a couple of things. This learning pyramid will be very helpful to use different techniques to help retain all of this information. You'll be learning a ton of information, so it's very important to repeat it and to retain it throughout. So the learning pyramid is also known as the cone of learning. It was developed by the National Training Laboratory during the 1960s. It is a theoretical model that illustrates various learning methods of learning along with their expected retention percentage. The pyramid illustrates how well one can retain information based on different techniques such as listening to a lecture, reading a book, or watching videos. And here we can see at just 5%, those are just looking at the lectures. At 10%, that's reading the lectures. At 20%, those are audio and visuals. At 30%, those are demonstrations. At 50%, it's through discussing. At 75%, it's through practicing the information. And finally, at 90%, it's teaching others. A good technique to make sure you understand the information is at the end of your study session, just whether it's a family member or another student studying for the NAPLEX, just going over what you learned that section or that day, and that'll just make sure that you fully understand the information. Another technique to keep in mind when studying is spaced learning. Spaced learning is an effective learning retention strategy that helps people learn quickly and efficiently while providing the added benefit of minimizing the loss of knowledge that occurs with one-time learning. It's based on the concept that learning is enhanced when knowledge is repeated after certain intervals. To implement spaced learning into your NAPLEX studying, you want to break down the lectures into several sessions or modules. This could be your notes or even these videos if you want to break them down in certain days, or just creating a schedule that works for you. Then you want to reintroduce parts of these sessions or notes multiple times over the next few days or weeks for learners to recall and retain the information long term. So by reviewing your notes or these videos daily, you'll see the information more and more, which will mean you'll basically retain the information, hopefully long term. A big thing when studying is stress management. Stress could make this process much harder, or if you are able to manage your stress, it'll make this studying process much easier, much more manageable. So here are a couple tips to manage your stress. You want to spend 5 to 10, 15 minutes daily on deep breathing or meditation to calm your mind. There are a couple apps that may help with this, such as Headspace or Calm. You want to have regular physical activity. Even a short walk helps release stress and clears your mind. You could try yoga or stretching for added relaxation. You want to eat healthy foods and stay hydrated to keep your energy stable. Avoid too much caffeine as it can increase your anxiety. You want to regularly quiz yourself with practice questions. Focus on your weaker areas to build confidence in them and ease your anxiety. You could implement the Pomodoro technique, which is 25 to 30 minutes of focused studying, followed by a 5-minute break. And after 4 cycles, take a longer break to refresh your mind. You want to keep your notes, flashcards, and study materials tidy to reduce any last-minute chaos and stress. Study with friends to share tips and support each other. Stay focused on productive discussions. Sleep is essential for memory and focus. Aim for 6 to 8 hours of rest, especially the night before the exam. You want to replace any negative thoughts with positive affirmations. Remind yourself that you're prepared and capable. Reduce any distractions while studying. Apps like Forest and Stay Focused can help eliminate social media use. Practice slow, deep breaths to calm yourself during studying sessions and for the exam. And lastly, here's a little bit of my advice to pass this exam. You want to begin studying in advance to allow yourself some time for thorough review. Break down the content into manageable sections and set daily or weekly goals. Stick to a consistent study routine, but allow yourself with flexibility for adjustments. Utilize review books, flashcards, and online platforms. Incorporate practice questions to get familiar with the exam format and time constraints. Test yourself regularly to gauge progress and identify any areas that need more focus. Prioritize key areas of pharmacy such as calculations, pharmacokinetics, and therapeutics, which we'll get into in later videos. Spend more time on high-weighted topics in the NAPLEX blueprint, such as patient safety and pharmacotherapy. Actively quiz yourself rather than passively reviewing material. Writing out what you remember or answering questions from memory reinforce knowledge better than rereading alone. Simulate the exam environment by taking full-length practice tests. I would fully recommend doing this at the end of your review, just because if you're starting off here, you're probably just starting to study, so you still have a lot of material to go. But doing this will help you build endurance, manage time, and reduce any anxiety about the test format. You want to break your study time into focused intervals, which will keep your mind fresh and help with information retention. You want to organize your study materials, notes, and practice tests so you can easily access them. Being organized will reduce stress and help you stay on track. The NAPLEX includes a significant portion of pharmaceutical calculations, so I would dedicate a good portion of your study time to this section. Get enough sleep, exercise regularly, and eat well. These all kind of seem obvious, but these have a huge impact on how you feel on a day-to-day basis. So it's very important you do these while studying. Your mental and physical health play a huge role in your ability to focus and retain the information itself. So if you manage stress with mindfulness, deep breathing, or relaxation techniques, that'll allow you to hopefully pass the exam on your first try. And you want to familiarize yourself with the NAPLEX blueprint, which will outline the competencies you'll be tested on. And this will ensure that your studying is catered to those competencies. And remember that the exam tests what you already know as a pharmacy student. So you want to stay confident and trust your preparation and avoid any negative thoughts. And lastly, I want to wish you good luck in your studying. I know the NAPLEX can seem a little intimidating. I remember when I took mine, it seemed very intimidating and just very scary, but there's nothing to be scared about. You've been learning this information in pharmacy school throughout your years, so a lot of the information you already know. So it's just about stress management and actually studying and putting in the work. So good luck, you got this. And if you are watching this video, I'm very grateful that I'm able to take this journey with you. So stay positive and be confident in yourself and never give up. Thank you so much for watching. Please hit that like and subscribe button, and we'll see you in the next video.